Welcome back, everyone, to OpenLine. Glad you're with us. We're talking about reopening schools, going safely back to school. Of course, metro schools start next week. Schools all across the state are going back. There are two districts that will start remotely, the two largest. Davidson County will start remotely, and so will Shelby County. And so that is where we are. We are talking with Dr. Penny Schwinn. She is the commissioner with the Tennessee Department of Education. And we're just going to start taking calls. I can tell you on Facebook, there are a lot of people that are very concerned about going back. Many people say we should not be going back. There's a back and forth. There's people that say we should be going back, but I'm sure you're used to that. I mean, that's the discussion. It's a definite back and forth. Let's start taking calls. Let's go to Reggie. Hello, Reggie.
Yes.
Go right ahead.
Hi, Commissioner Schwinn. I was just wondering, you guys have talked about these kits and these supplies that teachers are supposed to be getting. There are some schools that are already back in session and some that go back as soon as tomorrow. And those kits obviously have not arrived. Those supplies are not there for teachers. So they are going back, they are having students in the classroom, and they do not have the proper supplies. I know in many cases they haven't even been able to get a single container of wipes, or they've gotten a single bottle of hand sanitizer. What do you say to these teachers who are trying to go back to the classroom, who want to do so safely, who want to protect their kids, and they cannot do that because nobody has given them the resources to be able to do so? Furthermore, what can we say to our parents when we say, you know, they expect teachers to take care of their students? They expect teachers to protect their students. And right now those teachers are incapable of doing so.
Okay. I'll just let you respond to that, Commissioner.
Yeah, you know, Reggie, I appreciate that. And I think that I understand that concern. You know, I certainly think that when we think about the health and safety of our children, there's nothing that matters more. And I think the same thing with teachers. As I said, that's I'm thinking about my sister right now. So certainly when TEMA will be delivering those supplies, they're doing that and prioritizing in terms of reopening. This is the state supplementing what districts are already or should already be doing for safe and healthy supplies. It sounds like that's something that is an important conversation in your local district around what your teachers and staff need or might still need, but the state is part of what we're trying to do is to be able to deliver those additional supplemental supplies directly to teachers. One of the things that we will be doing is setting up a public dashboard where you'll be able to look at the delivery schedule for your school and see exactly when the kits and materials were delivered. We are prioritizing and rushing that as much as possible through TEMA, who will be delivering that, but certainly understand that we have districts that are open or opening, and encourage you to work with your district around ensuring that those supplies are in place, because the state is absolutely going to supplement what is already being provided. And I think that's the purpose of these classroom kits.
So you expect that to get there, I guess, soon. I didn't realize there were some schools opening tomorrow and some are already open. So you're saying districts are responsible for making sure those classrooms have the proper supplies, and then the state will supplement that? Or if there's a teacher that's out there and doesn't have the proper supplies, what should that teacher do?
Yeah, I mean, to be perfectly honest, if there are teachers who are in schools and they do not have the supplies necessary to keep themselves safe and healthy, that is something that needs to be escalated, certainly to districts and to the state. We need to make sure that all of our districts have what they need. But we also know that a lot of this these are financial considerations, and that's why I think the governor invested $77 million to ensure that teachers were going to get these kits. Now, I understand that we have 2 districts that are opening this week. We had 1 school in a district who opened Monday, and then 1 district who opened last week. We are prioritizing those districts in that order, and we are also prioritizing, obviously, those who are coming back in person because they have the greatest need earliest. I know TEMA is working overtime to make sure that we can send those kits out as quickly as possible. And again, we should have a dashboard up next week so that you can track exactly when it's delivered to your school to get those supplies. We'll be delivering them in big batches throughout the year. So Reggie, I hear that concern and would love to be able to help in any way I can. And so please make sure, if you can follow up, want to make sure that you get what you need to stay safe and healthy. That's incredibly important to me. And I think that the governor reiterated that yesterday, and that's why we're committing so many resources to this. But appreciate the concern. It's a valid one.
All right, let's go to Ann. Hello, Ann.
Oh, yes. Davidson County already has at least 2 positive employees, and they haven't even gone back to school yet. And those 2 employees got sick the first week of June, and we are just now hearing about it. In the last 10 days, children between the ages of 5 and 18, our numbers have increased 33% since July 18th. 33%. The ages 5 to 18 in 10 days. What do you say to our parents? It is not safe for Metro students to go back to school.
Okay. What do you say there? What do you respond to that?
So I appreciate the question, Anna. And so a couple of things. I would say, one, Metro Nashville is not going back to school in person, so they are opening remotely. I think when we think about that more broadly, though, across the state, and what a lot of our districts are wrestling with right now is, very candidly, it is not if, but it is when. We do know that there will be positive cases in school districts, and Dr. Piercy has been talking about that for a number of weeks now. What we think is incredibly important is that, based on whatever those local decisions are, that the health guidance provided by the CDC and the American Academy of Pediatrics is closely followed, that we're taking all necessary precautions to keep folks safe. We had the opportunity to hear from a number of national professionals this week and last week who talked about how critically important it was to take those very basic but very important steps around personal hygiene and safety. And so as districts are thinking about what makes the most sense for their communities, we want to reiterate how important those health procedures are, but certainly recognize that across the state, it's going to look different in every district. And our responsibility as a Department of Education is to ensure that if and when they have a case, and if and when they need to shut down a classroom or a school building for remote learning, they have the resources necessary to continue educating their students and keeping folks safe and healthy. So, and I appreciate that very much in terms of what that means for Metro Nashville and some of the tough choices that they're making. And certainly some of the choices that they're making to ensure they can continue to provide their children with all of the additional resources that they depend on at school, and certainly want to recognize their work in that space.
So the numbers Ann's talking about school-age children, that's 0 to 18, or 5 to 18. There were 6,827 on July 18th. 10 days later, that number jumped to 9,085. So that's in that age group of 5 to 18. It's a 33% increase. That's a significant number. And so you do have a lot of people who are saying, are we being responsible opening schools? Is the governor too eager to open schools? Should we just try and wait this out? And so you're hearing that in some of the calls. We're seeing that in some of the Facebook comments. What do you say? Are we just so? Do we have such a desire to open schools that we're kind of ignoring some of the red flags that we're seeing?
So I think that goes back to just how difficult this conversation is. And I want to encourage folks, certainly I'm hearing this from superintendents in the same way. It feels like a very easy A or B answer. And I think you're seeing half of folks feel one way and the other half feel very differently. And that's because everyone's in a different situation. In Metro Nashville, it looks very different than in some of our northern counties. Pickett County is one. I talked to that superintendent very recently. Very, very different scenarios and considerations for local communities, which is why we can't have a broad brush stroke across the state and a one size fits all. Now, that being said, when we think about what it means to keep a school open in a pandemic, and when we think about what it means for remote instruction, there are consequences for both. And I want to be very clear about that. If we have schools that are open, there are consequences around bringing folks in, especially when we're thinking about COVID-19 and a pandemic. We know that that's why it is so important to put into place all of the health precautions necessary to keep people safe and healthy. It is why, as a state, we will continue to invest additional resources above and beyond the ESSER money, above and beyond maintaining our full BEP, so that we can keep folks safe and healthy. I understand Reggie's comment earlier, and those are the types of things that helps us to provide even more resources and supports. But I also want to be very frank that when schools are closed, we have a 27% drop in the number of cases of child abuse. We have millions of students across this country who went hungry this summer. We have thousands of children in this state who rely on schools for health care, for behavioral and mental health supports, for disability supports, et cetera. Those services are oftentimes not provided or not able to be provided. We do not identify the children who are being abused in their homes. We do not have the same resources to make sure all of our kids are fed. There are very real consequences to students in the long term for that, on top of the fact that we know nothing replaces a teacher in a classroom. Nothing replaces a teacher in a classroom. There is no computer on earth that is going to make Miss McDonald different. So Miss McDonald's my kindergarten teacher. She was phenomenal. No computer will replace her. And when we know that children, especially our youngest children and our children with disabilities, our children who are vulnerable, when they do not have that level of instruction, when they do not have some of these other child well-being resources that we know are critical, that is a lifetime of consequences for them. And I think that's why this conversation is so complicated, because it is personal to every single person and family. It is why we are encouraging family choice and for parents to make the best decisions for their own children.
Okay, we're going to take a break. We'll come back. We'll continue taking calls. Fred, Olivia, Vicki, others, hold on the line. Take a break. Be back right after this.